Hello, my name is Brooke Bunch. I currently work at Jabal in the Sexually Maladaptive Youth Program. I have increasingly become concerned about the value of the treatment of adolescent sex offenders. As a result, I have chosen juvenile sex offenders as my topic for research. Some key terms important to understanding juvenile sex offenders are sexually maladaptive behaviors. Sexually maladapted children are children who have never learned appropriate sexual boundaries. The labeling theory will also be discussed in great depth throughout this presentation. Labeling theorists believe that labeling an individual as a criminal will lead them to further criminality in the future. Sexual abuse is also imperative to understanding sexually maladaptive youth. I will delve further into this onto the next slide. Sexually maladaptive behaviors that get a child arrested and or sent to a treatment facility include fondling, molestation, rape and sodomy, incest, public indecency, excessive masturbation, especially in public, and inappropriate touching. A large majority of juveniles commit these acts on younger siblings. Some statistics for you. Sexual offenses by youth account for the majority of sexual offenses committed in America. Most of society associates pedophiles as the perpetrators of sexual offenses against minors. Youth on youth, sexual offenses actually account for 1 in 3 sex offenses. 1 in 4 sex offenses overall are committed by youth. As a result of this label, juveniles tied to charges of sexual offenses are twice as likely to be beaten by staff, 50 times more likely to be attacked with a weapon, and nearly 8 times more likely to commit suicide. Trends of rape and sexual offenses of juvenile sex offenders are hard to evaluate. In 2013, the FBI changed the definition of rape to include penetration, no matter how slight, of the vagina or anus with any body part or object, or oral penetration by a sex organ of another person without the consent of the victim. The change in definition created a discrepancy in reporting practices. Data post-2012 era are not reported to national websites as a result. This slide contains a chart that I created based off of the OJJDP statistics of sexual offenses and forcible rapes. The rate of arrest for either crime have declined based on the increase of public scrutiny. Public scrutiny and recognition of the problem help to create programs for youth to prevent recidivism. Society places an importance of treatment of SMY children because of the fear of future recidivism. SMY children are actually least likely to recidivate. SMY children have recidivism rates of 5 to 14% versus 8 to 58% rates for common deviant behaviors. There's also an argument amongst scholars to decipher where to place these children. Some believe that placing them with non-sexual offenders will cause them to reoffend in the facility. Other scholars argue that these children can be placed with other offenders and will interact fine. Some scholars also argue that verbal and physical aggression in the home and within the individual create these sexually maladaptive behaviors. The biggest challenge when trying to work with these children is creating a welcoming environment. Many of these children have been sexually abused themselves. Understanding this barrier and working through the treatment with the children requires compassion and understanding. Yelling at children who have experienced trauma may re-trigger these emotions. Creating the supportive environment, as noted in the above picture, creating a positive self-image that then connects to positive interactions within society. Society, as I've stated before, has many false perceptions of adolescent sex offenders. They are typically associated with the same stigma that adult sex offenders face. Society's false perception has created this fear of sex offenders that their children will be susceptible in school and at home. Many believe that if juvenile sex offenders go left untreated, they will maintain the sexual offending behavior. This is partly true, as many adult sex offenses have admitted to having a history of sexual offending, according to several scholars. The major societal impact is reintegration or education of children who have never been socialized. Many of these children will re-enter society. If we expect them to follow societal rules, there must be some type of deterrence or socialization. There are several theories of deviance posed by scholars. Some believe that labeling these children as sexual offenders will only increase the likelihood that these children will reoffend once they leave treatment. Some scholars argue that juvenile sex offenders learn this behavior. Social learning theorists believe that because many of these children were sexually abused themselves, they associated this behavior with acceptable and normative behaviors. As stated before, society has perpetuated this notion that sexual offending is a result of the life course theory. Many believe that there is no hope for sexual offenders, that once they begin offending, it will continue throughout their lives. This can explain the relationship between juveniles and the courts that will be discussed later. There are 4 explanations of delinquent behavior: individual causes, societal, social structural factors, social process factors, and social interaction theories. Adolescent sexual offending can be explained through individual factors. These factors include biological factors and free will. Biologically, some scholars argue that an increased testosterone levels and history of mental health may increase the likelihood of sexual and violent offending. Free will may just be inappropriate voluntary experimenting by the juvenile. Social structure factors also determine the likelihood of deviance in juveniles. Many adolescent sexual offenders lack appropriate social structures. Many have weak social ties to their family, have antisocial behaviors, and do poorly in school. Structural functionalist models of deviance also explain how society interacts with these juveniles to either deter or create deviant behavior. As seen in the picture, individuals commit crimes which leads to public outrage, which creates social norms. Juveniles commit crimes because they refuse to adhere to these social norms. Social interaction also explains this delinquent behavior. As I've stated several times, many sex offenders have been abused themselves. This chart represents the protective factors associated with juvenile sex offenders. As discussed earlier, social ties and appropriate coping skills are vital to understanding how to treat these children. Teaching a child healthy boundaries, preventing trauma, stricter parental supervision, developing healthy friendships, creating open communication, having successful skills, and developing appropriate coping skills may prevent future recidivism. Societal institutions and social ties determine an individual's social capital. Strong familial ties and opportunities for quality education are examples of social capital. Many juvenile sex offenders have low social capital as a result of weak familial ties and failure at school. Most sexual offenses committed by juvenile sex offenders are done in school. Sentencing procedures also impact the socialization of sex offenders. Over the past few decades, there has been an increase in harsher, lengthier sentences. These sentencing practices are based on myths perpetrated by media. Adolescent sexual offenders are more at risk to become perpetrators of non-sexual crimes after release. Individuals who have been treated under holistic approaches have a decreased rate of recidivism. A mental health treatment-based approach interconnects all risk factors associated with sexual offending. Most scholars urge the justice system to comprehend the differences between adolescent and adult sexual offenders. Other scholars argue the importance of a case-by-case analysis of offenses, including the mental health element explored earlier. Typically, when individuals think of sexual assault and sexually maladaptive behavior, these thoughts are associated with males. Juvenile female sex offenders are actually constituting 7% of the juvenile sex offender population. These females are often younger in age and participate in multi-victim, multi-perpetrator acts. As you can see from the infographic, there is a type of victim blaming associated with females and male sexual assault. Society typically believes that men are unable to be raped as they become erect. However, this erection is the body's natural reaction to stimulation. This common misconception may be a major cause that the female sex offender population seems so low. Men, even young boys, are afraid to come forward about the abuse they have received. Many children who have committed sex offenses have been sexually abused themselves. In fact, scholars have recognized that about 80% of sexual offenders have been sexually abused themselves. Most of these encounters have been by someone the child knows, whether a family member or family friend. Lack of appropriate socialization can also impact the likelihood of an increase in criminality. Children who are never taught appropriate boundaries are unlikely to understand the magnitude of this problem. In conclusion, juvenile sex offenders are consistently stigmatized by society, resulting in perpetuated false perceptions that lead to harsher sentencing. These individuals are vulnerable to bullying and staff abuse in institutions and facilities based on their sexual offender label. A solution to this issue would be to institute mentoring programs for individuals without strong social ties. Teachers must be vigilant of their children's behaviors and notify of any anomalies. Understanding the risk factors and the theories associated with juvenile sexual offenses will also allow proper treatment to better society. Caregivers must understand their role in further stigmatization. To prevent the stigmatization, I've provided a sample of words to use with SMY children. These are my references. Unfortunately, most of the research comes from several years ago. As noted by Littrell and Miner, there are only about 200 studies and analysis of juvenile sex offenders. Thank you for listening.